So hello everyone. Today let us talk about something which you don't know, that is how to study anatomy in MBBS first year. So this journey when you have just come up from your 11th 12th classes directly to MBBS first year, anatomy as a whole core subject of first year MBBS can be very overwhelming, and this gives in true sense difficulty to you to remember things for a very long time, because anatomy is known to be a highly volatile subject. Highly volatile. So the right approach is very essential to get good marks in your exams, as well as to pass the exams with flying colors, and also to retain the subject for a very long time for your clinical knowledge in the later aspect of your life, as well as during the entrance exam, which again you will have to appear, that is for the entrance exam NEET PG or INI-CET. So again, so let us begin this topic by breaking down into smaller headings. Okay, so first let us talk about one thing, that is the main textbooks. Okay, so textbooks advice or recommendation is totally varying from person to person, but one thing which I have gathered since my last 10 years in this field and from numerous students experiences, I can tell you my list of recommended textbooks, but also you can check yourself any textbook by reading one chapter from any of the two or three in which you are confused. So you can have PDF of all the others if you don't have enough to purchase the book as such, but you can do one thing. So let us talk about the books. One, that is gross. Okay, gross anatomy as well as and general anatomy. Okay, both. So what are the textbooks? So we have Vishram Singh, BD Chaurasia, and there is another textbook, that is Yogesh Sontakke sir's textbook. Okay, so I will write the textbooks in my recommendation list manner. So I would prefer you to read first Vishram Singh Anatomy, all the volumes, okay, separate volumes, and that goes for neuroanatomy as well. Neuroanatomy separate volume for Vishram Singh sir, that is excellent textbook which I would recommend you. And there is another textbook, that is Yogesh Sontakke sir's. Okay, so that is also a newly released textbook, but initially in the first edition there were some minor spelling errors, but obviously with gradual additions that is going to be taken care of. And the third category I would keep it as BDC. Okay, so that is my recommendation, my understanding, because see, BDC is also good book, no book is bad, I would say. Okay, you can read any textbook, but this is the sequence which I would prefer you to follow, because certain places certain things are given better, okay, more in detail, more clinical things, so that way. Then if we talk about the other textbooks, so now I will be following a color coding here just to remember. So this is textbook which is the Indian authors textbook, and another textbook, that is the Gray's Students Edition. Okay, so I am labeling the other color for the foreign authors. Okay, Gray's Students Edition. Okay, Students Edition. The normal Teachers Edition is a quite thick book. I'm talking about the Students Edition. You should have the textbook with you, the hard copy preferably, if not at least the PDF. Then also you should have Netter's. Okay, Netter's textbook, that is the Atlas, Netter's Atlas. Okay, this is for images. Okay, obviously in your first year you already have physiology, biochemistry ahead of you, so you cannot read so many textbooks for one subject. So Netter's Atlas for images, or Gray's Students Edition for images. Okay, and also there is another textbook, that is Meckman's Atlas. Okay, this has cadaveric images. It's excellent textbook. I personally in my MBBS time also I referred to this, and nowadays the edition has changed, so obviously this has become very good textbook. So this is for your images. Okay, Then, and even if you should know that these images are even asked in NBE, the NEET PG entrance examinations, INI-CET, they take these standard images and frame the questions, image based questions. So if you start your journey with these, it will be very easy later on. You don't have to remember anything extra. Okay, then we talk about this was the gross anatomy, this was the gross as well as general anatomy, that includes the neuroanatomy as well. Okay, then we talk about the histology. So for histology, I would prefer you to go for IB Singh. Okay, age old textbooks, very good textbook given in a very lucid manner. Or you can stick to your simple, in certain MBBS curriculum colleges, if you see medical colleges, you will find the histology manuals are given by the institution, and those are quite detailed. They have the explanation, the tissues, all the salient features, identifying features on one side, and the other side is blank for you to draw the images. So if you have that, because I remember in KGMC when I was there, there was definitely that was given to the students. So it's a very good method to remember histology. So histology manuals, if you can refer to those also, not the senior manuals, those are having wrong diagrams. Okay, this is for text only. Okay, I'm referring to the text and images. Then you have another textbook that is D. Fior. Okay, again foreign authors. So D. Fior's histology. Okay, so this histology textbook is a standard textbook for histology, followed by, it is followed globally. So you can stick to any question where you are stuck in histology, you can refer to this textbook as the final answer. Okay, like you have Gray's Anatomy. So then we have embryology. Now for embryology, there is a textbook that is again IB Singh. I would recommend for the Indian author textbook. Okay, and also there is a foreign author textbook that is Langman. Langman is an excellent textbook. I would prefer you to remember and go for the conceptual understanding from Langman, because those textbooks will give you conceptual understanding of various difficult topics. So if you can read Langman for certain important topics, it will clear your embryo at core. Okay, so that is Langman. So we have these gross, histology, embryology. Okay, and then also another we have clinical. We have clinical anatomy. Nowadays the stress from NMC competencies is on the clinical anatomy. So which textbook we have, or clinical anatomy as well as reasoning, like the anatomical basis, those questions you can see in your 10-year papers. Okay, anatomical basis. So those are very important kind of questions. So these you can get from the Snell's. Nowadays we have Southeast Asian South Asian edition also, so they are edited by the Indian authors. So now the language is also very good. Okay, over the years it has improved. So Snell's, and then we also have Keith L. Murray. Okay, this is excellent textbooks for anatomy, clinical information. I refer to these in my lectures. I am using information from all these textbooks, a combo of all the important areas from good textbooks of anatomy to give you the best thing on the platter. Okay, so these are the textbooks which you should refer in your MBBS first year, ideally Snell's, Keith L. Murray for the clinical. Last, to complete the list, we also have the surface marking, for which separately you will be having a Viva in your colleges for surface marking. So for surface marking, what you can do, you can either refer to the gross anatomy textbooks which I have written above. Okay, gross anatomy textbooks, all these books have the surface marking things written. Okay, or you can refer to at the Halim. Okay, so there is Professor Halim's textbook which is very good. Okay, it is excellent, I would say, for surface anatomy. Okay, so that is my personal recommendation to you, to remember the different areas of anatomy. So that was first heading, that was the textbooks. I hope it has been cleared in your mind now. Then we move on to the next part, that is the 3D application. So nowadays AI is in the talks, so we should know 3D and AI when we have it, so we should use it. Okay, so 3D. Now 3D apps, there are so many 3D apps for picture memory, specifically for picture memory I'm talking about. Okay, because anatomy is all about images. So the more images you built in your mind, either through Gray Student Edition, Netters or Macmins or 3D applications, the better and longer you will remember anatomy. Okay, so talking about this 3D picture for picture memory, we have certain apps. Number one app which I am also using for teaching purposes, that is the Complete Anatomy app. It even has a patient module, so in practice later on you can use this to teach to the patient what problem does he have, where the tumor or the injury is happening, so you can completely guide the patient. Also there are some clinical case scenarios also given, that even cadaveric images are also there. So it's an excellent app, Elsevier app, and it is actually having the facts taken directly from the Grays, so there is no error as such. Okay, I have even contributed to the platform initially in my MD time for the editing purposes, and this app is actually very good now. It is in the best form possible right now. Another option you have, that is the Visible Body. Okay, Visible Body. These both the apps are available in App Store, Google Android, anywhere you can use Windows, Mac. So you can practice things, you can remember things better using these applications. What else? So for picture memory we have these 3D apps. Number 3, we need to have something in the DH. So for DH classes you should be having a dissector manual with you. Okay, dissector manual. Now which dissector manual? Globally standard followed, that is the Cunningham. Okay, Cunningham's dissector. Okay, so this has different volumes, and you should have this textbook with you to see any confusion, where if you have any confusion while cutting any structure, how to approach any structure, so you can read the steps and you can approach that structure. Suppose if you don't have time or if you can't do it, so at least bare minimum is at least read, sorry, at least you should be reading the first chapter completely. Okay, first chapter of the first volume. Okay, first chapter, first volume. So this have to be read by all of you, because this gives a very good orientation. Even the second chapter, so the first 2 or 3 chapters, they are very excellently important for you because you are starting your journey, so you should be knowing them. Then what else you should have? You should have the dissection kit. See why I am focusing on this and writing specifically, because dissection kit is something, if you don't have, you will not touch the cadaver, and if you don't touch the cadaver, you will not do dissection. You will just be standing and leaning forward and trying to visualize the structures. That you can do on a video also. YouTube videos, cadaveric videos are available at multiple platforms, you can see them. So what's the benefit of coming to the college and seeing the cadaveric dissections? Many colleges in India, unfortunately, they do not have cadavers. So just imagine the state of those students. They do not have a cadaver for dissection, and in certain colleges on 100 students we have 1 cadaver or 2 cadavers, and in other colleges, good colleges, government colleges, we have 100 students, we have 5 cadavers, 6 cadavers, 10 cadavers. So it's a wide disparity we have, depends on region to region. But wherever you are, at least if you are having the cadaver, feel yourself lucky that someone has donated the body, and please utilize your time in the DH. Instead of chit chatting, gossiping, roaming from one table to another, you keep on roaming because you think other table is teaching better. It's nothing like that. Even if you stand there, listen, you don't revise, it will be zero. So please spend your good time on your own table, on your own cadaveric dissections, and please ask again and again, see with your friends the structures again and again. So that is very important. Bring the dissection kit, and what all you have to bring in the kit, I have already told you in the introduction to the cadaveric dissection, my video already. So that includes the scissors, the scalpel, okay, fine scissors, okay, scalpel, and forceps. Now forceps, there is blunt forceps, toothed forceps, okay, and fine. Okay, so these 3 or 4 instruments you should carry every day. Nothing extra is required. Magnifying lens, probe is given in your kits, not required. Okay, just stick to what is I'm telling you, that's more than sufficient. Okay, so you can have these instruments with you. Fine scissors, okay, this is the fine scissors, okay, small scissors. So these things you should have, plus you should have gloves. Gloves, have extra gloves, pair of gloves for you and for your friends also. Okay, so please have these gloves, because even if you're not dissecting any day, at least you should wear the gloves and handle the specimens, even if someone says whatsoever, because that can give you infection otherwise. Okay, so any bones or anything you are having, you should have gloves with you. Okay, so next, the need of the hour, that is AI. Okay, so I'm making this video in this world of 2025. So if I don't talk about AI, my video is incomplete. And myself, I am a very tech freak, tech savvy person. I use AI for multiple aspects in my life. So I would recommend you certain tools which you can use for further things. And now recently the Google Gemini has actually gone free also, if you know. So just follow those updates also. So you should be using Gemini. I will tell you how. Google Gemini, okay, Perplexity, very excellent tools. I am using daily basis. Perplexity, and nowadays Chat GPT, which I am putting in the third number. Although Chat GPT is going free tomorrow onwards for 1 year, pan India. Okay, so Google Gemini, Perplexity, Chat GPT, these all you should be using for what purpose? Not for googling the anatomy stuff. You should have your textbooks for that. But for what purpose? You can actually upload any book chapter, PDF, okay, to these tools, and you can get your answers. Maybe you can help them to summarize that chapter. You don't understand, suppose cardiac cycle, you are not able to understand, you can upload that PDF. You can scan the PDF from your core textbook or have the PDF online. It's available some many places. So you can use those these tools from the information which you have given, not from the internet sources, because otherwise anatomy will be difficult for you. They will give you some different branches which is not given in the correct answer. So you can use this way for any kind of queries like quizzes. You can have some notes making. Then there is another tool that is again by Google only, that is Notebook. That is Notebook LLM. I don't know, have you heard of this or not? Notebook LLM. Now Notebook LLM is again a very interesting tool for again notes. Okay, you can again use the same procedure. Okay, upload the PDF, own PDF. Okay, or you can upload your own notes also to make good notes, and you can have some quizzes, okay, for your interesting learning, gamification of the learning. Okay, and audio summaries. If you are traveling somewhere, you can have some audio summaries playing back in your earphones, so you can close your eyes and listen to anatomy 15 minutes, 10 minutes audio summaries of your own notes. So that will give you good revision. Okay, the revision is the key. You have come here after clearing NEET, you have revised the topics multiple times, you know that. And audio summaries as well as podcasts. Okay, this is something which I am posting on my channel also relatively every time. So this is a very excellent tool. Two people are talking and you are always interested to listen what two people are talking. Okay, so they are talking anatomy, they're not talking any crappy stuff. It's not Big Boss. Okay, so actually the list of tools is endless in AI. Okay, so then we come on to, some people have asked in personal queries also, that is the good note taking apps. Good note taking apps. Now what are these apps which you can use for good note taking? So the good app is Good Notes, which I am using right now. Okay, I am using this to make the notes. I always use this. I love this personally. I have the premium version. Or you can use Notability. It gives excellent laser tools which you can use to highlight. Like I have a tool here to highlight any stuff which I can show, read anything. Similarly, you can use Notability, which will give you more controls on that, but the interface is totally different, so you may or may not like it. Then these are all premium apps. Okay, so people are asking, sir, we don't have money, I wanted free apps. So what are the free apps available? We have MS Note, Microsoft OneNote. OneNote is free with 5 GB of storage, that is more than sufficient. Okay, then Cola Notes. Cola Notes is also a free application available in both the platforms, okay, iOS or Android. Then you have Official, which you always ignore. Official Notes, okay, Official Notes app is always there in Android or iPhone, iPad, everywhere it is there, but it has limited functionality, but yes, they are improving every time. So these are free alternatives. Okay, so these are some good note taking apps. Next we talk about number 6. Number 6, that is the osteology. Now osteology, that is the study of bones, so you have been taught in your colleges regarding the bones. So suppose you are studying humerus, then radius, ulna, and so on. So to study any bone, I would prefer you to study the distal, study the proximal and distal bones together. Okay, what do I mean for this? Like if you're studying scapula, please study the clavicle and humerus together. If you are studying humerus, study the radius ulna together and also the scapula together. So don't study them isolated, study always the next bone and previous bone together. What will it will be, how will it be useful for you? Because it will be helping you to remember the attachments better. Okay, for attachments, this is for attachments and direction of muscle fibers. Now what to do with the direction of muscle fibers, sir? Why, how it is important? It is important because it is the only thing which will help you to remember the action of that muscle. Okay, suppose if pectoralis major muscle fibers, you know how they are oriented, how they are inserted into spiral muscle, so you know how the fibers are going from where to where, so you can guess the action. Okay, if the muscle will contract, what will be the action of that muscle? Similarly biceps, so you know if the muscle is going in this manner, if it will contract, what action will it produce? So that way, so you should be able to recapitulate these things together. What else? A very important point which no one does, but it is very important, that is always and always discuss the bones with friends. Okay, gone are the times of your 11th 12th class when you could sit at your home or sit at one corner and study the textbooks and clear the NEET exam. Now it's MBBS, it's a vast course. No one single person sitting at home or sitting at one corner of the hostel can remember everything. Anytime you can ask him, he remembers anything. It can never happen. Okay, so what is the best way? Discuss with your colleagues, okay, your batchmates, and that will help them also to remember and you also. Okay, so what will happen? This will help you to understand the discuss with friends for positioning, anatomical position of the bones. You take that bone in your hand, teach another person, tell him to teach you another bone, and similarly in let's say 15 minutes 20 minutes you can revise 2 bones or 3 bones. Okay, so that way it's a very fast method of revision and for a longer time you will remember. See, just giving you a live example, I have been teaching anatomy for many years now, so now by in my nerves or veins the things are running. I can tell you by hinge what you are asking. But initially when I was studying anatomy for the very first time in my life, I also could not remember. Okay, but the only catch point is the more you teach, the more you repeat the things, the better you get at that subject. Simple. Okay, it's for anything in your life. You drive a vehicle, the more years you pass driving the vehicle, the more better you get. So apply that to your studies. Don't miss that anytime. Okay, so positioning, anatomical position of that bone. Okay, let me write it. Oh, sorry. For anatomical positions, anatomical position, I'm talking about osteo only right now. Okay, anatomical position, then general features. So general features, like someone taught you today humerus, so you came to know for the very first time in your life there is a trochlea, there is a capitulum. so you don't remember these names. So what you will do, you will teach someone, you will remember better. Okay, and also it will help you to remember unknown points. Suppose if you were taught by XYZ person, or you saw one XYZ person video, you missed some points. Someone else taught you the same bone in different manner, or adding some points which you don't know, so it will help you. So similarly it will help the other person also. So this is excellently important. Next we come on to seventh point, that is note making. Okay, note making. Now it is a very important area which no one talks about. So when you are sitting in your class, in your lectures, boring lectures or energetic lectures, good lectures, I don't know how you are attending the lectures, how you are finding the lectures, but whatever lecture is always boring for anyone in this world. Okay, so some people make it interesting. Okay, but some people, most of them, that you lose attraction after some time. Like the attention span of a usual individual, as per the studies data, you will find max to max 30 to 40 minutes, not more than that. You lose attention at after that time. So note making, what you will do in a person who has come to your college, who is taking a lecture, very much information is there in a very short time he has to cover. It's not his fault, it's your fault. You have to note down important things. So what you will do, you will write down the headings, very important. Don't aim to write every word from his slide or textbook, or sorry, or whatever he is speaking, or whatever he is writing on chalkboard or iPad. Do not expect yourself to write everything, it's not possible. He will move ahead, so you will miss that. So note down the headings, because already you have everything in your textbooks. I already told you the textbooks names. Then after you note down the headings, you have to note down the keywords. Note down the headings and then keywords. Okay, keywords, like for example, keywords like for example, if someone is teaching you shoulder joint, so someone will begin with introduction, then someone will talk about the type of joint. Okay, so then articular surfaces, bones involved, so ligaments. These will be the headings, these will be the main headings which you have to note down simultaneously. It's not a difficult thing to note down. Then keywords, someone is talking about the ligaments, so some names are given for the ligaments, so you just note down the ligaments. Then he will tell you about the details about the ligaments, that you listen. Okay, that you see the images. That is how you attend the good lectures. Any lecture from any platform, you should follow this basic thing. You will never miss to write, and you will never miss the lecture, and it will become interesting. And do not match the things from your own textbook. I see people are matching what the teacher is teaching. Please trust him, he is teaching you right. Okay, so do not match, do not create any query. Just at that time listen, be receptive. Okay, so note down the keywords, headings, and then what you will do afterwards, in the evening time, you have to spend 15 to 20 minutes by writing those headings or keywords, or highlighting those in the main textbook. Okay, so you write or highlight. Okay, if it is not given, then write, otherwise highlight in the main textbook. So main textbook, I mean one textbook you will keep for your main. Suppose if you are following Vishram Singh Anatomy, so please follow that textbook by adding everything whatever you get from other sources into that textbook. I used to add some pages, okay, A4 size sheets you can add. So that way at night before the exam, you have to just remember that single textbook including everything. So that is about the thing. Then you can also have a diagram notebook. Okay, this is something which you can make. Okay, diagram notebook separately. So I used to have this in my MBBS time. Okay, so you can have a blank pages copy, you can purchase it, and you can make important diagrams, maybe sketch diagrams or colorful diagrams from any region whatever is taught to you. So upper limb, you should be able to note down all the important diagrams and draw them by your hand once, at least once. Then having understood so many things, so sir, we now know what to do, how to do, but now I don't know how much to study. Okay, I have everything, I know everything, but how much to study, what to leave, what not to leave. So the answer is in this, that is must know, versus good to know. Must know versus good to know. So what is that? So there is something that is must know. So must know topics are, you have to identify those topics, and NMC is very helpful. They have given NMC competencies in front of every chapter. Okay, those are starting with AN and then some numbers is given like 10 point something. Okay, so this way. So NMC competencies, those are must know, which you have to remember. Examiner will frame the MCQ or question from that in the your exam. Plus these are clinically relevant topics, must know. Okay, there is some clinical importance, applied anatomy related to that topic, so it is important. Do not ask anyone, it is important. Also it is given in your 10-year paper list. ठीक है, 10-year topics list. So be it for any MCQ entrance exam or 10-year important exam, so that is given in your important areas. So must know is these areas only. Okay, then good to know is extra stuff which you may or may not remember, may or may not remember. Okay, at least if you have heard it or read it once, that is more than sufficient. No one is going to ask you about that. Okay, then we come on to number 9. Number 9, that is something which you again ask multiple times. 10-year important topic list. Okay, so 10-year important list, this varies from college to college slightly. Okay, but how will you use this list? You should have this, use it as a map. Use it as a map for your easy preparation. Okay, for your easy preparation. Now very important, how will you use it? All super important topics, you can segregate the topics into 2 categories. Number 1, that is the super important topics, that is those topics which are repeated. Okay, repeatedly asked. So that you have to cover first and most importantly. Then there are important topics, so that means those are also important, but you can do them later. You may or may not get a question from those. So first do the super important topic, then you touch upon the important topics, and the early you make the list yourself, the early you will get better marks in all the exams. Okay, then also how to make this list customizable to your college. See, you will get these lists anywhere. Okay, but the main problem is your professors will be repeating some topics. Sometimes they will keep on repeating those facts. This artery comes in this relation. They will ask you in DH also, they will ask you in lecture theatre also, they will ask you, you know, interactively they will ask you, and they will keep on repeating that same facts in different lectures. You will see many teachers are asking or talking about the same thing again and again. So they are not mad. They are helping you to remember that this is important. So please have your brain and eyes and ear, you know, open. They are talking again and again about the same thing because it is very, very, very important, and you cannot afford to not remember that. Okay, so please mark them, mark that topic, mark that thing in your textbook. Okay, wherever you get to know. So that is the most important area which many people miss. Okay, then if you think there is a surprise MCQ or a surprise question, that will be surprise for everyone. So don't worry about any random questions which may be asked in 1 year or 2 years. Then last, that is the test. So there are some tests, that is the class test, PCT, PCV, stage test, all these tests you have to appear. Now why you have to appear? For sure, please appear them. Okay, for what purpose? For attendance. Obviously attendance is important, there is no other option, you will be debarred from your main exam otherwise. And also for your internal assessment. So why this is important? Many people don't understand this actually, so that's why I'm stressing upon this. See, any exam, if it comes all of a sudden, a surprise test or anything, it will be announced, maybe a part completion test, you should appear. I know you will be never prepared, you will never be prepared perfectly for that exam, but you please come to the exam, because first you will have a writing practice. Okay, you will sit down for 3 hours or 2 hours or 1 hour and you will practice writing, which you have lost, okay, since a very long time. And MBBS curriculum, it will give you, you know, confidence. When you think you don't know anything, but when you will sit writing, you will be able to write. So it will be very good when you will be seeing yourself drawing so nice diagrams in your first or second exam. Another thing, suppose if a student A who has not appeared out in 5 tests out of 10, he has not appeared only, he has been absent, compared to the person who has appeared in all the 10 tests, maybe he has got 10 marks, 20 marks, does not matter, but he has appeared. So who do you think will be in high in internal assessment? Obviously the person, second person who has at least appeared, because even appearing in the 5 tests out of 10, it's no guarantee you will pass in all those. Okay, so please appear for all your exams, that is very important. And if you get a chance to find your love, so you can be a couple and then you will definitely attend more classes, attendance will be full. Then lastly, there is something that is the other platforms. So there are many platforms available right now teaching you things about the curriculum from the MBBS first year syllabus. So you, if you have money to spend on those, you can spend. The platforms are plenty, they are ranging from 5,000 to 50,000 a year. So you can, if you have that pockets, you can purchase it. Otherwise you can follow whatever I have told you till now, and no problem will happen if you can, you know, properly follow all these steps. So now after understanding everything, now I would like to just take a brief upon a little bit more things, that is how to write your answer in theory. Okay, so I'll touch upon 2-3 things more, that is theory first. Okay, so in theory, always try to attempt the questions in sequence. Okay, very important. Attempt the questions, attempt questions in sequence. And if you can't attempt in sequence, you don't remember, strike off, leave some space for that question in the beginning, and later on if you can't recall, then strike that space. That way you will not lose on any marking scheme. Okay, so the examiners are differently checking the questions, so if you don't attempt them in sequence, it will be a problem while you get the answer sheets checked. So attempt questions in sequence always. Okay, and attempt all, and attempt all questions. Okay, so attempt questions in sequence and all questions. Second thing, use black pen for headings. Okay, like I am using right now, use black pen for headings. Number 3, that is use time management very carefully. Okay, have a watch in front of you. So if you don't follow this, you will be in a trouble, because many people study properly, they know everything, but they are not able to write in the given time. So that is a big problem. You have to practice this, and also use black pen for headings and no red pens. Okay, so red pen, because it is used for marking, so no red pen anywhere. Okay. Okay, so this is also very important. Use time management according to what? According to the marks distribution. So just pay attention to the distribution. Like for example, do not keep on writing in detail in the draw well label diagrams only. It is asking only diagram, so please stick to diagram. Enumerate only, so don't write anything extra. Just write the 1 2 3 4 points. No extra information is required. You will not be getting marks for that, and you will lose the time which you will be otherwise spending upon the short note. Okay, you think you will, you don't know short note, when you start writing you will remember. Okay, and help is always there around you, always. Then highlight, oh so sorry, then highlight keywords at the last. Highlight keywords at the last. Okay, so if you get time in the end, after you have done your paper, just highlight the main words in your sentences in this manner. Okay. Number 5, so use flowcharts and bullet points. Okay, no examiner has so much time to read your paragraphs. Okay, so please use bullet points and flowcharts, okay, and headings and subheadings, very important. Okay, then write applied anatomy or clinical integration, which I am teaching in my own lectures also. Clinical integration heading always at the end. Clinical integration as a note, okay, in all your answers. Okay, so you can use Snell's clinical anatomy or Keith L. Murray, as I told you in the beginning. So clinical integration, or you can give the heading applied anatomy. Okay, applied anatomy. Number 7, that is draw diagrams. Very, very important. Don't hesitate to draw the diagrams in your main exam. Draw diagrams. Okay, so because anatomy exam paper is all about diagrams, so if you have not drawn diagrams, you will not get good marks. That is simple, and you may even fail your exam. Okay, so next, that brings us to the heading, that is diagrams. Okay, diagrams. Now for the diagrams, you need to pay attention about some things. Okay, before I talk about this diagrams, let me show you this in the form of better heading. Okay, so just have a look at this diagram. Okay, so for any diagram, you should have an outline. You should draw an outline. Number 2, you should have a good proportionate size. Okay, so suppose if you're drawing a diagram, you're writing this, suppose I've given an example. Suppose this is the A4 sheet. Okay, so you start writing here and then draw the diagram in almost half page, and then you write. Okay, what people actually do, I've seen students doing that, you keep on writing and you draw the diagram very small in one corner. So this won't give you any good marks. Okay, so please, size proportion is very important, don't miss that. Number 3, that is labeling. Okay, I will tell you about labeling in a while. Labeling. Number 4, that is the arrow diagram. Arrow diagram, as you can see in this example. Number 5, you have legend or the caption. Legend or the caption. Okay, and then number 6, we have color coding. Color coding. Number 7, we have placement. Okay, so now see all these points carefully. So number 1, the outline. So outline, you can draw a box maybe. Okay, then size I have already told you. Labeling, so just have a look, try to label all the things on the right side of the image, or you can label on the left side in a symmetric manner. Now you see all these labels are ending at one point in one sequence. You can see at one level all the labels are being done. It's not that something's labeled here, something's labeled here, something here, something. That will make your diagram very shabby. Okay, then you have to for sure draw this arrow diagram. Okay, then you can also remember to write the schematic diagram to show the XYZ thing which is given in your diagram. So you should write the caption always, do not miss that. And sometimes in caption you can also specify the view. Okay, like it's a coronal view or a section is given. Okay, view or section also you can mention in the caption itself. Then color coding, very important, I will talk about in a while. And then you have placement. So placement I have told you. Now placement, see, suppose if you have this A4 sheet, you start writing and place your diagram in the middle and then start writing. Okay, so do not do one thing. People are doing one thing, that they are writing in the A4, they are just writing and in the next page they are again writing and lastly they are drawing the diagram. That is not the correct approach. And either ways, if you do another method that you draw the diagram first, suppose if you're drawing the diagram and then writing, that is also not good, because examiner thinks that you have not written anything. So best approach would be if you follow in this manner, that you should be writing some things and then drawing, and then writing some things and then drawing. Okay, so that will give a mixed match approach, so examiner will not give you less marks for your answer. Okay, so that brings us to the color coding now. Color coding. I will rearrange the slides in the PDF later on. Okay, so next we come on to the heading, that is the color coding. Okay, now color coding is very essential. You should follow this for your exams. So artery should be given the red color. Artery red color, or the origin of muscles should be shown with the red color. And you can draw the artery in a single stroke, and you can draw in this manner, so that way you can show the arteries. Okay, another method is you can draw double lumen structure, but I don't recommend this kind of drawing, because it will take much more of your time, and time is something which you don't have. Okay, so you can label the diagram in this manner. Oh, sorry, you can draw the arteries in this manner also, but the preferred thing is the first one. Okay, then you have the veins. Okay, veins. Oh, sorry. Then you have the veins in blue color. Insertion of the muscles. Okay, and the venous sinuses in blue color. Then in green color you have the capsules. Okay, ligaments. Okay, the fascia, specifically the deep fascia, which you have to draw in certain diagrams. Okay, then yellow color you can follow for the nerves. Okay, I don't know, maybe you are able to see, it is for the nerve. Then fat and superficial fascia. Okay, superficial fascia, I will highlight this, don't worry. Okay, superficial fascia. Oh, just hold on. Okay, okay, so I think it is legible, there is no problem. Then we have the muscle bellies. Okay, so muscle bellies you can draw with the brown color. So muscle belly you can draw with the brown color. So you can follow this way, you can shade the area in this manner, or what you can do, or you can draw in this manner and then again use the color for the shading purposes. Okay, then you can add this color and then you can shade in a brown color, you can use the brown color for shading purposes. Okay, so you can, in this manner you can shade the inner part of this muscle area. Okay, so you can follow any method whatever suits you, but this first method is very easy, second method is quite time consuming. Okay, then you have the bones, which you should be drawing with the black color. Okay, bones. Then we have the lymph nodes. Okay, lymph nodes and lymphatics. Lymph nodes, lymphatics and the viscera. Okay, all these in the purple color. Okay, so this can be variable, but this you have to remember. Okay, then last but not the least, which is left, that is Viva. Okay, a little bit about the Viva, which you should be knowing. So number one, answer only that what you know. Okay, very important, answer only that what you know. Please trust me, I am not telling you this just like that. So if you know something, then speak the word. Otherwise, don't utter a word which you think it may be related to it, because it may be totally different at the place of the body which you may be thinking. So that way you will fall into your own gutter. The examiner will question you, then what is that? Okay, so don't do that. Then second thing, do not beat around the bush. So if the examiner is asking you the branch of certain artery, so if you don't know, you can say sorry, there is no problem. Okay, but do not say anything extra. Sir, let me tell you about the pectoralis major first. Let me tell you about the corrective epidural fascia. People try to act smart, but those people don't get good marks. Okay, then number 3, allow the examiner to ask more questions. Okay, allow examiner to ask more questions. Okay, so by this I actually mean, if you know the answer, suppose if you are if someone is asking what is this muscle, so you are answering pectoralis major, so then you start speaking. The examiner has just asked you what is this structure, you just stay shut after saying pectoralis major. Don't keep on saying, sir, let me tell you the origin first, insertion first, then let me tell you the nerve supply, then let me tell you the action. No, you are killing your questions. Then he will shift to the other part of the human body to ask you other questions which you may not know. So don't try to act smart, you will fall into your own gutter while answering. Number 4, that is act confident. I've seen many people who don't know anything but they are very confident. Okay, so be confident. Okay, no matter how much you know, because your body language is also important. No hands in the pocket, very important. Examiner, very age old examiner, they get irritated. Have your good clean apron. Then voice should be very confident. Like suppose if I am teaching you something, I am very confident in teaching you. Suppose if I say how to study anatomy in MBBS first year. Okay, so first thing I think the answer only. So you say, sir, please stop the video, I don't want to watch you. Okay, so voice is very important. Then non-verbal communication. So what is this non-verbal communication? That is your eye contact. Okay, so eye contact is very important. You should look forward straight into the examiner's eyes and answer. Okay, so sir, the osteo, sir, the humerus, I don't know, sir, I am not sure. Okay, sir, upper end of humerus. This way you will not get marks. Okay, have confidence, look into the examiner eyes. If you know the answer, please be confident. Okay, so number 5, that is the side determination, which I told you, very important. Side determination is something which you have to hold the bone in the same hand. Okay, this is for the osteoviva, specifically for the osteoviva. So suppose if you are holding the bone, you have to justify with the help of 3 aspects, with what part is anterior or posterior, what part is medial versus lateral, what part is upper versus lower. Okay, lower part of that bone. Okay, so you have to justify these 3 aspects of every bone and start the discussion in this manner to justify whether it's of right side. Sir, this is the right humerus because medially this is present, 2 features. Sir, laterally this is present, anteriorly I can see this is present, posteriorly I can see this is present. Then upper end is this, lower end is this, having this. So this way you can add in a single 1 or 2 statements, you can justify the right or the left side of that bone. You will get very good marks, trust me. Okay, so that's it. I have tried to cover maximum. I have taken some good amount of time, but I have tried to cover maximum part of how to study anatomy in your MBBS first year. I hope you have understood well. So if you have any queries, please feel free to answer, ask anything in the comment box, and see you in the next videos. Thank you.